was sitting in my lawyer's office when she slid a document across the desk and pointed to a single phrase I'd said during my labor, words the hospital had fought 6 months to keep hidden. "Right here," she said, tapping the page. "This is why they're terrified." The notation stared back at me. Patient stated, "I do not consent" multiple times during exam. Exam completed per physician order. Reading, it felt like being gutted again. I had said no. I had used the exact words that should have stopped everything. But they hadn't stopped, and the one phrase that should have protected me became the evidence the hospital tried to erase, because those 3 words transform a difficult delivery into something they can never call routine again. 10 months earlier, I'd been different. I was 32, a middle school teacher, married to David, and pregnant with our first baby after 2 years of trying. I'd read every pregnancy book, attended birth classes, emphasizing informed consent, and hired a doula named Patricia, who promised to help me advocate. My birth plan was detailed but flexible. I wanted unmedicated birth, but was open to interventions if medically necessary. I toured 3 hospitals before choosing Memorial Women's Center because their website boasted patient-centered care. I interviewed my OB, Dr. Harrison, extensively. She seemed perfect, listened carefully, answered questions thoroughly. I practiced phrases with Patricia. What are the benefits and risks? Can we wait and reassess? And most importantly, I do not consent. Patricia told me those words were legally powerful, that they required medical staff to stop any non-emergency procedure immediately. I memorized them like a protective spell. I had no idea how meaningless they would become. My water broke at 38 weeks, around midnight on a Tuesday. David and I arrived at the hospital by 1 a.m., excited and nervous. Intake was smooth. I answered questions, signed admission papers, was shown to a labor room. My nurse Caroline seemed experienced and kind. She started an IV, hooked up the fetal monitor, explained everything clearly. Dr. Harrison wasn't on call, but her partner, Dr. Reeves, was, and Caroline assured me he followed the same philosophy. My contractions were mild, about 8 minutes apart. David and I talked and joked, timing contractions, completely unaware that the 7 a.m. shift change would bring someone who didn't believe patients had the right to refuse him anything. For 6 hours, my labor progressed beautifully. Patricia arrived around 3 a.m. and helped me through intensifying contractions. By 6 a.m., I was managing well, feeling strong. Caroline checked me at 6.35 centimeters dilated, right on track. "You're doing amazing," she said warmly. But Caroline's shift ended at 7, and the nurse who replaced her, Janet, had completely different energy. She was brusque, checking monitors without eye contact. When I asked to unhook and use the bathroom, she sighed. "You should stay in bed. Makes monitoring easier." I felt the first prickle of unease, but dismissed it. Looking back now, I can see that shift change was when everything shifted, when staff supporting my autonomy left, and those viewing my body as hospital property arrived. Dr. Reeves came in around 7:30, a man in his 60s with silver hair and absolute authority. He didn't introduce himself, didn't ask how I felt, just snapped on gloves. Let's see where we are. He moved toward me, and I instinctively closed my legs, confused by his abrupt approach. I need to check your cervix, he said impatiently. Okay, but can you explain why? I asked. Patricia had taught me to ask questions. Dr. Reeves' face darkened. I'm checking your dilation. That's standard care. Now, open your legs. Something in his tone made my stomach clench, but I was mid-contraction, and by the time it passed, he was already examining me. His fingers were rough, painful differently than Caroline's gentle checks. I gasped and tried to pull back. Stay still, he ordered. The exam went on forever, his fingers pressing and probing invasively beyond clinical necessity. When he finally withdrew, I was shaking. 6 centimeters, he announced. We need to speed this up. I'm breaking your water more fully. Wait, I said, trembling. My water already broke. That's why I came in. He was already reaching for an instrument that looked like a long crochet hook. There's still significant fluid cushioning the baby's head. Breaking remaining membranes will bring the head down and speed labor. Patricia stepped forward. What are the risks of that intervention right now, doctor? Reeves didn't look at her. The risk is labor takes 12 more hours if we don't. That wasn't a medical risk, that was his convenience. I don't think I want that procedure right now, I said carefully. I'd like to see how my labor progresses naturally first. Dr. Reeves turned to me with pure contempt. You don't get to decide what's medically necessary. I'm the one with the medical degree. Now lie back. I felt David's hand squeeze mine, felt Patricia's presence solidify, but also felt crushing powerlessness descending. This man didn't care what I wanted, but I had the words, the magic words Patricia said would stop everything. He was moving between my legs with the instrument. I need to discuss this with my partner first, I said. There's nothing to discuss, doctor. Reeves replied, this is standard intervention for prolonged labor. But I wasn't having prolonged labor. 6 centimeters after 6 hours was textbook normal. Janet placed her hands on my knee, pushing it aside even though I was trying to keep my legs together. Please wait, I said, voice rising. I don't consent to this right now. I do not consent. There they were, the words. I had said them clearly. Everything was supposed to stop. Patricia told me those words had legal power, that they created a line no provider could cross without committing assault. But Dr. Reeves didn't even pause. You consented when you came to the hospital, he said. And then I felt the cold instrument push inside me. The pain was sharp and shocking. As he deliberately ruptured the remaining membranes, I felt the gush of warm fluid, felt him moving the instrument roughly. Stop, I cried out. I do not consent. I do not consent to this. I said it over and over, each word desperate and clear. But his hands didn't stop. Janet was holding my legs apart, actually restraining me, while Dr. Reeves completed the procedure, regardless of my explicit refusal. I can still feel that hook inside me, still hear my own voice, screaming words that meant nothing. Patricia was documenting everything on her phone with timestamps, whispering that she'd witnessed it all, that this was assault. But all I could think was, I said the words. I said them exactly right. And it meant nothing. My right to refuse was theoretical, something written in pamphlets but not honored when a doctor decided his judgment superseded my autonomy. Dr. Reeves stripped off his gloves casually. "Your contractions will pick up now," he said clinically. "We'll check you in 2 hours." And then he walked out. My labor did intensify after he artificially ruptured my membranes, contractions becoming brutal with almost no break between them. I begged for an epidural 2 hours later, not because I couldn't handle pain, but because I desperately needed to escape my body after what had been done to it. The epidural brought physical numbness but no emotional reprieve. Every time the door opened, I flinched, terrified Dr. Reeves would return. When I was fully dilated, a different doctor delivered my baby. Dr. Reeves' shift had ended. My daughter Lily was born healthy at 4:23 p.m., 8 pounds, and screaming, absolutely perfect. I should have felt joy, triumph, relief. Instead, I felt numb, disconnected. David kept saying, "We did it. She's here." But I couldn't shake the feeling that something had been stolen from me, something I'd never get back. What I didn't know yet was that the hospital was already working to bury what happened, that I do not consent would be erased from my records everywhere except one overlooked notation. I was discharged 2 days later with standard paperwork. Nobody mentioned Dr. Reeves. Nobody asked if I felt violated. I tried talking to a discharge nurse about the forced procedure, but she cut me off gently. Labor is traumatic for many women. It's normal to feel things move too fast, or you weren't in control. That's just the nature of childbirth. But that wasn't what happened. This wasn't about feeling out of control during unpredictable labor. This was about explicitly refusing a procedure and having it forced on me while restrained. I called the hospital's patient relations department 1 week postpartum. The representative listened politely and said she'd investigate. 2 weeks later, I received a letter saying Dr. Reeves had followed appropriate protocols and that artificial rupture of membranes is standard intervention. No acknowledgement that I'd refused, no mention of consent violations. I requested my complete medical records immediately, certain they would show the truth. All those times I'd said, "I do not consent," would be documented. The records arrived 3 weeks later. I read through every page with growing horror. Dr. Reeves' note said simply, "Patient at 6 centimeters dilation, AROM performed to augment labor. Patient tolerated procedure well. No complications." There was no documentation of my refusal, no record of me saying, "I do not consent," multiple times. No note that he'd proceeded over my objections while I was restrained. The official record made it look completely consensual, routine. Every piece of evidence of my resistance had been deliberately eliminated. That's when I called Patricia and asked for her notes. She'd kept detailed documentation with timestamps.